So certainly, JAK inhibitors such as Ruxolitinib provide important clinical benefits for the treatment of patients with myeloproliferative diseases. It's also, I think, well established that these drugs as a class, while they do provide symptom benefit, spleen volume reduction, their ability to eradicate the underlying malignant clone is relatively minimal. And so we have really taken the approach that we need to better understand the signaling networks more broadly in cells from patients with these diseases so that we can identify vulnerabilities that may be targeted either alone or in combination with JAK2 inhibition. And to do so, we've utilized a technology called CyTOF, or mass cytometry, which enables us to profile signaling broadly in actual MPN patient samples. And over the course of several years of work, we've utilized this approach to identify dysregulated activation of the NF-kappa-B signaling pathway. And in particular, in patients with myelofibrosis, we found that this pathway was hyperactivated. And we also identified that the NF-kappa-B pathway is really central to the abnormal production of inflammatory cytokines in these diseases. And as a result of this work, we have focused on targeting the NF-kappa-B pathway therapeutically, and we're doing so with a drug called Pevonedistat. This is a NED8 activating enzyme inhibitor that inhibits NF-kappa-B signaling. And we have found in our preclinical studies that Pevonedistat does block NF-kappa-B signaling in MPN patient cells. It very potently blocks inflammatory cytokine production, and it also has activity in vivo in animal models of MPNs. And from this work, we have initiated a clinical trial combining Pevonedistat with Ruxolitinib. So this is a phase 1 dose escalation study with Pevonedistat, treatment for patients who are taking a stable dose of Ruxolitinib, and that clinical trial is currently ongoing. The other part of my talk also related to aberrant signaling, but more specifically has been focused on looking at mechanisms of disease progression in MPNs. And utilizing a gene expression profiling approach, we identified upregulated expression of DUSP6, which is a phosphatase that regulates the MAP kinase signaling pathway. And in exploring the impact of increased DUSP6 expression in MPNs, we found specifically that the gene is increased in patients who had transformed to acute leukemia, and that aberrant signaling through DUSP6 is transmitted downstream through RISC1 and S6. And this signaling axis can be targeted pharmacologically. And we found that in our animal models, targeting this pathway also provides benefit in terms of MPN disease features. So this is also a pathway that is potentially translatable to the clinic with clinically available compounds.